Okay, so I have gathered my supplies on the table. I'm going to verify the 6 rights medication. The patient is Bridget Kaiser. The medication is morphine. The dose is 6 milligrams. The route is intramuscular injection, and the time is 1 dose now, and I will be documenting once I finish the procedure. So, hi, my name is Brittany. I am going to be your nurse today. I'm going to close the door to provide patient privacy. Can you please tell me your first and last name?
Bridget Kaiser.
And what's your date of birth?
7877.
Okay, I verified that you are the correct patient. Are you allergic to anything? Medications, foods, seasonal allergies?
No.
Okay. So I'm going to... Today, I'm just going to be giving you your morphine injection right now. It's just to help with your pain. Some of the side effects, when I inject, you'll have some stinging or burning, a little bit of pain. You might also be a little bit tired. You might have a bit of nausea or constipation. But please let us know if you have any adverse reactions, which would be like super slow heart rate or shallow breathing, chest pain, or excessive tiredness, like you're going to pass out. Do you have any questions?
Nope.
Okay, so I'm going to perform hand hygiene with hand sanitizer and don clean gloves. Okay. The medication that I'm giving today is, the order calls for 6 milligrams of morphine. On the medication, it is 4 milligrams per milliliter, so I'll be giving 1.5 milliliters. I'm going to clean the top. Okay. And I'm using the 1-inch needle and 25 gauge. So first I'm gonna get 1.5 milliliters of air, and I'm going to inject it into the top here, and then I'm going to pull 1.5 milliliters, and I'm going to make sure there's no bubbles. Okay. Oh, and the order calls for 1.5 milliliters, and I have verified there's 1.5 milliliters of medication in the vial. Now I'm going to inspect the site. So first, it's going to be, I'm using the vastus lateralis muscle, which is a large muscle, so it can handle 2 to 5 milliliters of medication. It is on the anterior aspect of the thigh, and it's the middle third of the thigh, which is the site that I've chosen. I've inspected the site for redness or swelling or bruising, and there is none of that. I'm also going to palpate for tenderness. Is there any tenderness?
No.
Okay. So now I'm going to clean the site. Okay, and I'm gonna make sure not to touch it, and I'm gonna let it dry completely before injecting. Okay. And I'm gonna inject at a 90-degree angle quickly, and I'm going to aspirate to check for blood. So I'm going to pull back for 5 to 10 seconds. Okay, there's no blood. So now I'm going to inject the medication at 10 seconds per milliliter. Okay, now I'm going to hold the needle in for 10 seconds. Okay, and now I can pull it out and use gauze. And I'm not massaging the area, I'm just gently holding pressure on it. And there's no blood, so she doesn't need a bandage. I'm gonna remove my gloves and perform hand hygiene. And I'm going to go document.